Photodynamic therapy is probably the latest and most important innovation in cosmetic treatments. Actually it came about as a treatment that's FDA approved for precancers, and it's actually covered by insurance for that. And what we found is when we were treating patients with 20 or 30 precancers, lo and behold, they also got incredible results as far as facial rejuvenation, just completely smooth skin.
Okay.
So we found that this treatment also can enhance results from IPL or pulsed dye laser, and with a completely different mechanism, works for cystic acne. So what the treatment is a light-activated medicine, and it's a clear gel that's painted on the skin and has to sit on the skin for an hour or two. Then the patient has a light treatment, and it can either be a blue kind of lamp that you just lie down under for 20 minutes, or it can be treatment with the IPL or pulsed dye laser, depending what we're trying to achieve. For precancers...
So it's a medication that's applied to the skin?
Right.
Okay.
And the medication by itself doesn't do anything unless it's activated by one of these light sources. And the light source we use really depends on the patient. Now for cystic acne, we can do it with the blue lamp, but then we can also do treatment with the pulsed dye laser followed by the blue lamp. And what that does is treat the redness, treat the acne, and actually treat or improve the acne scars. Now I actually have a picture I wanted to show you. She's an ideal patient for photodynamic therapy or phototherapy. She presented with this severe cystic acne as a result of having been on prednisone for a medical condition, but yet she did not want to be on any oral medication. She was planning to get pregnant in the next couple of months and wanted her skin all cleared up. So acne like this, of course, we will treat with topical antibiotics, benzoyl peroxide or retin-A, but that's clearly not enough. So what we did for her was do several exfoliating peels using a combination of peeling agents, and those procedures are done by our esthetician. And then we followed that with treatment using the blue lamp alone, which is an easy treatment, no redness, no peeling, and that treatment actually kills bacteria. And then for the residual cystic acne that didn't improve, she had one treatment with photodynamic therapy using the medication under the blue light. That does take about 2 days to heal from. There is a pretty bad sunburn reaction for a couple of days, a little redness after that, but I think her results are dramatic.
Yeah, it's great.
And I think...
Are those typical results? I mean, somebody with acne can go in with the blue light, with this photodynamic therapy, great for acne.
I think it varies on the patient. Some patients clearly need intense oral therapy, such as a vitamin A medicine called Accutane. But for patients that don't want to take oral treatment, usually a couple of photodynamic treatments, 2 or 3, will put their acne into remission even for 6 or 8 months.
Now this is a young woman. What about the 40-plus woman with the aging skin? I mean, if they've only had IPL alone or pulsed dye alone, this photodynamic gives just much better results?
Well, the patient it's going to work really well for are patients that have precancers or general roughness of their skin. Because with the photodynamic medicine, the Levulin, the skin will actually peel and many of those rough spots will come off. And I should mention, if someone has had precancers or even skin cancer, doing this treatment can be preventative. So it can prevent future precancers for up to 3-4 years.